Good evening to all. I am Dr. Asavri Sawant, Public Health Specialist at IHW Council, and I welcome you all to the exclusive Hypertension Awareness Series, an initiative by Integrated Health and Wellbeing Council powered by Servier. According to the Indian National Family Health Survey 5 of 2019-2021, it is observed that 21% of women and 24% of men have hypertension. 39% of women and 49% of men aged 15 years and over are also pre-hypertensive. May is the National Health Awareness Month recognized every year by the Government of India. May is also the May Measure Month, which is the global campaign by the International Society of Hypertension. Partnering up with Servier and joining the May Measure Month, Integrated Health and Wellbeing Council has organized a month-long initiative to raise awareness on the growing burden of hypertension and to make people aware on the different aspects around hypertension. This live session, we will discuss the topic of leveraging partnerships for maximizing health and well-being in hypertension. We have an expert set of eminent panelists here with us who are from all different walks of health. We have dietitian Ishi Khosla, who is the clinical nutritionist, columnist, and a very famous author here with us. Ma'am, we welcome you to the show. We welcome Dr. Akshay Vodhraja, who is the Senior Consultant of Respiratory Sleep Medicine and Pulmonary Hypertension at Akash Healthcare. Sir, welcome to the show.
Thank you.
We welcome Ms. Sucheta Kandekar, who is a yoga master trainer and founder of Koham Fit. Ma'am, welcome to the show.
Thank you.
We would also be joined by Ms. Kitty Kalra, who is a celebrity fitness trainer and STOTT Pilates expert. She would be joining us shortly. So let us start with this discussion. We have a mixed set of panel here with us today so that we can understand how allied health aspects are also equally important other than medication and treatments so as to keep your hypertension levels in check. In this session, we would be discussing about how maintaining good health and good holistic health would help in the long run in keeping hypertension at bay. So let us start our first question with Ms. Ishi. Ma'am, can you please share what dietary changes can effectively lower blood pressure and manage hypertension? Are there any specifics to food and nutrition that should be included or avoided when it comes to hypertension-friendly diet? Over to you.
Well, thank you, Dr. Sabri. Yes, diet is a cornerstone for treatment of hypertension, and several aspects of diet need to be considered. And over the past so many 50, 60 years, we all know that there are some key aspects of diet like sodium and salt, which impact blood pressure. But besides that, we also know that obesity and excess weight are important aspects of maintaining a good blood pressure. But so basically, it's the total caloric intake, what you have, and the nature of the calories that you have. The caloric intake is one part, but also what you eat in terms of what is the level of inflammation in the diet. The dietary choices have to be what we call typically anti-inflammatory diet. We have had a lot of success with what we call the DASH diet, the dietary approaches to stop hypertension, which is basically around increasing certain foods like vegetables and fruits and good fats, healthy fats, and fish and lean meats, etc., and some amount of dairy. And so this particular approach with having low processed foods and low sodium have been found to have favor with impact to blood pressure control, and not only that, other aspects of cardiovascular risk. Then we have the Mediterranean diet, which is again the same thing, which adds the good olive oil and which adds the basically the element of good fats and having some good wines and antioxidant rich diet. So all of these approaches have been found to be useful in managing blood pressure. And simply put, I would say today we are in a position to label or reduce a diet to an anti-inflammatory diet rather than any other. And if we choose a diet which is basically home cooked, which does not have too many processed ingredients, which is rich in good fats and multicolored vegetables and fruits, and modest in red meat or avoids red meat, and good protein, plant protein, and fish with the omega-3 fats. I think that is the boundaries around which, or a framework around which, a good diet can be made. But having said that, whatever you eat, it should be your weight, your BMI, and your waist measurements should be also addressed, along with a healthy lifestyle. Alcohol, smoking, and all that, we all know those need to be addressed. And one very big one is stress. And before I move to the next question, whenever you ask, it's basically also to do now with gut health. It's not only what you eat, but what you digest and how your gut is processing it, and the gut microbiota in balance is a critical factor in in managing hypertension. There is mounting evidence today about the role of the microbiome. So it's all of that: eating clean and eating foods which are good for you without causing inflammation, having a good healthy bacteria, are the real keys.
Thank you so much, ma'am. As our audience is both from medical and non-medical backgrounds, is from mixed backgrounds, can you please help us understand how and inflammation can affect hypertension in the long run, as you suggested to follow the anti-inflammatory diet? So what would happen if we are following a normal diet that is causing us inflammation in the body? How would it relate with hypertension, if you can please explain?
That's an excellent question and a very long one, but I will just make it very simple. Simply put, the gut microbiome is what I call the control panel today, and it has the maximum number of immune cells and maximum concentration of the microbiome is in the gut. So they include all the bacteria, fungus, and the viruses, predominantly bacteria, which have their own genetics, and the host also has its own genetics, and the interplay between these bacteria is literally like an orchestra. So the interplay is what determines which gene will manifest, which neurotransmitter, which hormone, which nutrient is going to get affected and absorbed or not absorbed. So they determine our risk to various conditions, and they really determine what we call the difference between ill health and health. So they hold the key, and there are several mechanisms which have been found to disturb, by which they get disturbed, and they become pro-inflammatory. They impact lipopolysaccharide secretion, short chain fatty acid production, TMAO production, etc., etc. So those will become very long and lengthy to at this point to mention, and beyond this. But there are various mechanisms by which we get pro-inflammatory effects of the disturbed gut microbiome. One thing that everybody who's hearing must understand, that the biggest culprit in disturbance of the gut microbiome when it goes out of favor is our food. And actually, when I say favor, we have a combination in a normal gut also between the healthy and the unhealthy, the pathogenic microbes. But it is when the number or the concentration of the healthy ones goes down and the pathogenic ones goes up, is when we have ill health. So to keep this balance symbiotic, to prevent the dysbiosis, the biggest tool that we have is a healthy diet. And the biggest disruptor of the gut balance, of the dysbiosis, I would say the biggest disruptor of a healthy gut ratio is like I said earlier, our food, and of course, all the chemicals which we are surrounded by. We have poisons, etc. In our food, in the air, in the water. We all know that we can't control that. And also stress is a big one, which kind of really impacts the balance between good and bad. So, and medication, chemicals through medication also disturb the gut microbiome. And these trigger these pro-inflammatory cytokines and other factors which I don't want to get into at this point. And that is the starting point. And that can, basically they travel systemically. So it all happens in the gut, but then it can affect the kidneys. And that is where hypertension begins. And like I said earlier, they also control our nutrient absorption. So how much of sodium we're absorbing or how much of potassium and magnesium we are not absorbing or not absorbing is also controlled by them. So micronutrient malnutrition is also associated with hypertension, and this is controlled by the gut microbiome. So the inflammation is a starting point, and the impact is manifold. And we can have a full webinar on that. So I will just leave it at that.
Certainly, ma'am. So all the points that you have touched upon could be an entire session in itself.
Yes.
But let us move on to the another aspect. As we are celebrating Hypertension Awareness Month, and yesterday on 17th of May, it was World Hypertension Awareness Day. So one aspect of hypertension is also pulmonary hypertension. My next question is to Dr. Akshay. Sir, can you please help us understand what is pulmonary hypertension to begin with? What is the relationship between pulmonary hypertension and overall health? And how does it vary from what we call as high BP, or in the layman language, normal hypertension? Over to you.
Yeah, thank you. So I'm glad you picked up this particular disease, that is pulmonary hypertension. We are very much aware about what hypertension is. It is the increase in our blood pressure, systemic blood pressure. That is 120/80. If it is more than that, we call it hypertension. But pulmonary hypertension is a specific type of hypertension which happens in the vessel, which is from the heart to the lung. So it happens when the pressure in the blood vessel leading from the heart to the lung is too high. So normally this distance is very small. So the pressure is usually very low. It is less than 25 millimeter of mercury. If this particular pressure increases, it causes decrease in the oxygen saturation and systemic disturbances. So it happens because of a lot of things, not just the lifestyle, but it could be genetic. It could be because of some other disease, like, of course, hypertension, if it is uncontrolled, or some other cardiovascular diseases, even diabetes, and obesity is one of the leading cause of pulmonary hypertension. So there are several causes of pulmonary hypertension, and it is underdiagnosed, misdiagnosed, untreated mostly. Even hypertension is underdiagnosed. So pulmonary hypertension is something people are not aware about it. It is not usually picked up. People don't know what it is, what are the symptoms. And it is usually picked up very early during the 2D echocardiography, which happens in a routine test. If you go for an annual health checkup and 2D echo is advised, sometimes you see that the pulmonary pressure is around 30. But people don't usually are concerned about it because they don't know about it. And the symptoms of pulmonary artery hypertension are usually very mild to start with, and it usually progresses with age. It is usually detected in young age. So if I talk about the symptoms, it includes dizziness, headache, palpitation, chest pain. You can have breathlessness during exertion. So these are the symptoms which are very non-specific. So you have to get a echocardiography done to know whether you have pulmonary artery hypertension or not. So it is not usually hereditary. It doesn't have to be hereditary. It can be because of so many other things. So the only way to find it out is a 2D echocardiography. That is the most simple test to find out. Now, this also leads to anxiety, depression, stress. There are so many things associated with pulmonary hypertension, as with hypertension, of course. And all of these factors are significantly correlated with poorer quality of life. So there are risk of small blood clots in the vessels of the lung. There is risk of arrhythmias, that is irregular heart rate. There is risk of bleeding if you have pulmonary artery hypertension. Yes.
Thank you so much, sir. And completely, as you shared, we agree with you that normal hypertension, that is systemic hypertension, is also people are not very much aware about. That is why initiatives like these are helping people understand what it is. And if you feel any of these signs and symptoms, go get yourself checked. You might be suffering from hypertension. As hypertension is a lifestyle disease, it is unfortunate to say that almost in every Indian family, one person is hypertensive or is detected with hypertension, and that too making people aware on the rarer form of hypertension, which is pulmonary hypertension. Definitely more awareness is required. So in
Yeah.
your experience, can you please help us understand how common is pulmonary hypertension, and how many people in India are approximately suffering from this? If you can just help us.
So there is no data for the Indian population because it is a very underdiagnosed thing. Indians don't go for regular health checkup. A very small lot of population go for a annual health checkup. So the number is not known, but throughout the world, the cases are around 1 million per year, which is not a big number, but still knowing that how dreadful this particular entity is, disease is, uh, the number is still very large. Now, this is again a very because it is an underdiagnosed thing, we don't know the exact number of cases. But if I talk about my setup, I usually see at least 2 to 3 cases daily who are newly diagnosed pulmonary artery hypertensive patients. And the causes are different in all the patients. It could be some heart disease, even it happens in a chronic lung disease patient or a chronic liver disease, patients who have liver cirrhosis or they have chronic kidney disease. Even those patients can develop pulmonary artery hypertension. And there are so many other patients who come for just an corporate health checkup and they are diagnosed with this particular thing. And when I ask them whether do they have any symptom, they say no, we don't have any symptoms, so we won't like to get it treated. So the main problem is awareness and the patient education. So we have to educate our patients and they should know what pulmonary artery hypertension is, because the symptoms are very mild and it gradually progresses and you don't know, sometimes it progresses in a year. And the mortality and morbidity is a lot with pulmonary artery hypertension. So the number is small just because we are not getting tested for the pulmonary artery hypertension.
Got it. Sir, we will come back to you on the diagnosis and treatment aspect of this one. But moving on, let me ask the next question to Ms. Sucheta. Ma'am, we had Ms. Ms. Ishi Khosla explain us that gut microbiome and anti-inflammatory diet is very essential for hypertensives or keeping yourself healthy from hypertension. So, in yogic guidelines, are there any additional lifestyle practices or recommendations, such as dietary consideration, that you recommend alongside with yoga support for maintaining overall health and well-being of someone who must have been detected with hypertension? Over to you.
Yes, certainly, Dr. Asawari. So yoga looks at the entire body in layers. So it's not just our physical body that yoga looks at, but it looks at the physical layer, which is known as Annamaya Kosha, which is made up of the food that we eat. Anna is the food that we eat, and that's the physical body, which is the grossest level that one can actually perceive and feel. Then beyond that, or just beneath that, is the energy body, or it's known as Pranamaya Kosha. And then beyond that or beneath that is the Manomaya Kosha. So yoga thinks that all these three are closely connected. So what you think affects your overall energy body, and what is happening in your energy body is going to show up or manifest in your Annamaya Kosha or your food body, right? So yogic practices certainly would be very, very helpful. And it's proven that when you work on the bridge, which is your pranamaya kosha, that is the breath body or the energy body, then it surely connects the mind to the gross body. Okay, so practices like mitahar, since you asked me about the diet, mitahar is a practice which is highly recommended in Hatha Yoga. So mitahar is where you keep the 1/4 portion of your capacity empty, or your stomach empty, and eat only 3/4 of your capacity. So that's a standard and very simple to follow practice that yoga recommends in terms of diet. Now, in terms of the other yogic practices, the asanas, of course, pranayam and meditation. When it comes to asanas, any body, any posture that opens the chest or the heart, that is highly recommended, because it is going to create more space. It is going to give you more space to breathe in easily. Because most of the times we see that the hypertensive people, their posture is kind of constricted or restricted. So their back or the muscles around their neck they are also tense. That's because they hold all of their tension in this area, right? So a lot of poses in yoga which open up your shoulders, shoulder joint, your chest, your heart are recommended. Then certainly the breathing practices, pranayam, as a part of your lifestyle, and of course meditation. It's just that when it comes to meditation, most people do not know how to meditate and what do I exactly do when I have to meditate. So a simple practice like, just observing your breath and counting your breathing rounds for just 3 to 5 minutes is also a very, very effective and simple tool. Thank you.
Thank you so much, ma'am. You were able to cover the dietary considerations, the different layers that are there in the body, and also meditation. We would want you to talk a little more about the meditation aspect, as we have heard that stress management and relaxation is very helpful in managing hypertension with people, and has seen to be observed in some studies. Can you please help us understand how important is this? And how can yoga practice benefit such individuals, especially who are having been detected with hypertension or are pre-hypertensive?
When we talk about pre-hypertensive or people who've been detected with hypertension, and we all know that stress and hypertension is closely related. Now, there are several yogic practices, one of which we know, meditation, but we use this term meditation in a very generic sense. But we can actually talk about specific yogic practices, and what I really highly recommend is the practice of yoga nidra, which is very, very important and effective. It is proven effective in management of hypertension. That's because in yoga nidra, what happens is it is a guided practice. In meditation, a person who is just left to meditate doesn't know what to do. And most of the people, when they close their eyes, especially those who are having hypertension, they feel that they are not able to concentrate and they just don't know what to do. So they end up stressing themselves more. So yoga nidra is a practice that is done in a supine position where you lie down comfortably, and it is a guided practice. It has certain steps, like the first step is your shithilikaran, that is the body relaxation. Then the next step is the prana vikshana, where you actually observe your breath and understand the breath. And what happens is the stability in the body leads to slowing down of the breath and gentleness and softness in the breath. And obviously, when your breath is softer and gentler, it is going to help you make your mind available for meditation. Otherwise, what happens is the mind itself is so preoccupied that it is not even available for relaxation or meditation. So in yoga nidra, step by step, you get that person into this state where the mind is available, and then in a guided way, you can actually look at the root cause of the meditation, because then in yoga nidra practice one works at the one is the mind, the brain is operating at the alpha or theta waves, which is more available for relaxation, where the deep emotional release can happen. So I personally highly recommend the practice of yoga nidra for hypertension.
We will definitely come back to you, ma'am, as this is something that we would want to touch upon in little more detail and specific asanas for hypertension as well. But before that, my next question is to Miss Kitty. Ma'am, you have extensive experience in Pilates, and this is one subject that not most health practitioners talk about, because many of them are not aware the benefits of Pilates can do to your overall health and well-being. Hence, we have you here to guide us on, can Pilates exercises be beneficial for individuals with hypertension as well? And if so, how can Pilates, and this practice contribute to their overall health and well-being? Over to you.
Thank you for having me over. And yes, it's a great learning platform even for us with all the other speakers here. Just like Dr. Akshay said, that hypertension is probably in 1 out of 10 adults. And with a little research that we all know, it's actually called a silent killer, which not many people know. And it's more prevalent in people over 40, especially for men. So any physical activity where the heart rate and the exercise brings it up to about a 40% to a 60 or a 70% will become very important to manage hypertension. And that's where Pilates comes into play, because it actually works at a heart rate of 50% to about an 80%. The kind of moderate exercises that Pilates has is very beneficial for hypertension.
Thank you, ma'am. Also wanted to know if there are any specific Pilates exercises that should be, advised, that you would advise in your practice, especially for reducing stress or anxiety or hypertension, high blood pressure, if there is anything like that. Can you please touch upon?
So another word for Pilates is actually called mind-body movement. And it started about 100 years ago as a rehabilitation plan for the army men. I know a lot of men don't do Pilates. They think it's more feminine, but it's got a lot of health benefits. And especially the mat-based exercises are very good for not just hypertension, but even other kind of effect for breathing, for other mobility and strength. And that's why it works on smaller and bigger muscle groups and engages the core muscles. Now, once your core muscles are engaged, your breathing pattern, your whole body, your posture alignment, everything comes into play. And a lot of mat exercises, there are over 200 to 300 exercises that we can do on the mat. And I'm sure Dr. Sucheta will also say the same about yoga. And there are a few exercises which are the single leg stretch, double leg stretch, the ab prep. I know the names all sound like Greek and Latin here maybe, but these are all exercises which work at a moderate level, and hence anybody can do it. And it's very beneficial for the people who are down with hypertension because it just calms you down. Pilates is actually called contrology, where it works on breathing and it helps you flow with the movement. Plus, you have to engage your core. You have to listen to your instructor. So the instructors have to be very good who are teaching you Pilates, because you have to be engaged. And that's why breathing really calms you down. It helps you stay in alignment. It helps you stay centered. So it's a very, very good, and a whole approach is to calm down the mind, and it helps in stress management, anxiety. It's a very, very effective way, I would say, just as yoga is.
Thank you, ma'am. And we sure do recommend people with hypertension to look into different avenues for managing their stress, their health, as well as their diet. Coming on to the diet aspect, the next question for Dr. Ishi is, ma'am, hypertension and diabetes and obesity are the lifestyle diseases. They are so common in the world that they are considered just like another lifestyle, because they go on for a longer period of time and basically are part of your life. So Why is it so? I mean, we are tackling many other diseases head on in India. We have specific programs for elimination of polio, elimination of AIDS, and other aspects. We also have few programs that are tackling hypertension directly, but hypertension complete elimination in India, do you see this as a vision in near future? Would this be possible? If so, what are the major steps that are required for every individual to follow in their life? What would be your guidance to them?
Dr. Sabri, that's a fabulous question because it is really like a reality check. Where are we headed? We have so much information out there today. We have made the right noises for everything. Like you said, obesity, we've counted calories, we've counted carbohydrates, we've counted fat, we've gone on crash diets, we've stepped on treadmills and Pilates, and we've burnt out ourselves in gyms, and we've upped our protein and done everything possible. And now even looking at apps, everything is now even you're getting reminders on apps to drink your water, and it goes on that far. Has it translated in real-time benefits? That is the question, and I'm very glad that you're talking about it. To be honest, in most cases of these lifestyle management diseases, whether it's obesity, diabetes, heart disease, we haven't cracked it. It's not helping. One of the key reasons is we have not looked at sustainable dietary approaches. We have not looked at practical conversations and communication with people. We have got too nutrition-centric rather than being food-centric. We have to talk food with people eat, and we have to make messages which appeal to the whole brain, not just logic. Food is very dear to us, and simply putting knowledge to food is not going to change habits. So what I'm saying is that somewhere our approaches have become too nutrition-centric. We have to talk real-time food. We have to talk food practices. We have to talk in a language which people are able to follow, and not just put labels and calories and fats on back of pack and then leave it at that this is the sodium and this is the fat percentage, and this is it really is not adding up to anything substantial. Rather, it's creating damage and confusion, and sometimes really lopsided kind of diets. There are people who are picking up artificial food, fake food, because it has certain protein content and it has certain vitamins, and that protein is processed protein. There is no food in it, and it's only got vitamins, etc., which are chemicals, and they call it food and they feel it's very healthy. So it's really become a very half-truth and half kind of lopsided approach. And I'm so, in my practice, I feel we need to, when I do what I do, I get the results, so what is the difference is we also need to understand that one of the reasons why we're not able to stick to diets, why we're not able to manage our weight problems, etc., is when we do the diet, we lose 10 kgs or 15 kgs or 20 kgs. And the minute we stop doing the diet, it kind of just falls flat because we've not understood the food. So essentially, it cannot be an on and off. You'll get the benefit of yoga and Pilates and whatever exercise, walking, till you do it. The minute you stop doing it, it's not permanent, right? It will go away. So we therefore need to make this a lifestyle and also understand where you're going wrong. Why are you not able to stick to the diet once you give it up? Because there are addictive components in food. In wheat, we have morphine effect. In sugar, we have a cocaine effect. So all of these, they get you. They kind of, they affect your brain in a way that you can't stop. They have a drug-like effect. And all the processed food that we eat is designed to be addictive. You put caffeine in colas to make it addictive. So there are many, many changes in the food ecosystem, and therefore, for the listening audience, everybody feels like a failure sometimes when we're not able to manage things. And oh, I didn't exercise enough. Oh, I didn't. I couldn't control my evening meal, and I ordered something which was not to be ordered, and it just everything fell flat. We all feel we are drowning ourselves in guilt, and that becomes another counterproductive issue, because then you give up and then you say, "Chalo, jo ho raha hai, ho raha hai." So essentially, understanding why I'm making this point is that understanding where you're going wrong, where are the triggers, and removing those triggers is the only way, sustainable way of dealing with obesity. And I think the issue of gut we've started with is also bringing us to an issue of food sensitivities. Why people today are complaining of so many food allergies is because of the change in the gut microbiome. So food sensitivities and testing for that can also help us deal with our gut microbiome, and we can tamper with our eating behavior and our choice of food, the cravings, if we affect the gut microbiome positively. And so there are all these correlations which need to be made. I'll just give you a simple example. We all have the ability to manage our food. We are born with it. A baby cannot be given an extra drop of milk if the baby doesn't want it. An animal in the wild will not overeat, will never be obese, because we have internal checks and balances. What spoils it is the food that we eat. When we eat the trigger foods, when we eat the wrong grains, when we eat too much sugar or processed food, those checks and balances get out of order. And the good news is that when you remove those, within a few days, those patients come back feeling all in control and in charge. We didn't have cravings. We didn't want to eat extra. Our appetite shrunk. All of that happens. So that means our body is coming back to a normal state. So getting to that, therefore, to answer your question, that is there a vision? Yes, but I think the vision has been really strengthened and can become a reality by Prime Minister Narendra Modi and the United Nations, who has supported the mission of bringing back millets. The year 2023 has become the year of millets for no coincidence. It has been deliberately done to bring back the right grains so that India can become, and not only 70 other countries can follow and bring back the health and the vibrancy of the population. Malnutrition can be addressed, and the answer is in really changing the grains and going to the gut level, and happens automatically.
Thank you, ma'am. That was amazing listening to you on different aspects. And along with that, India is also having this India Hypertension Control Initiative, the IHCI, another national program for prevention and control of non-communicable diseases. So we hope to make more and more progress every year and completely eliminate non-communicable diseases. But one point that you said really stuck to me, that was making your dietary choices sustainable, making it a habit. And we really feel that hypertension and other lifestyle diseases have been difficult to completely eliminate because they're part of your life. Your habits define your health. And if we were to have sustainable healthy habits for the long run, we would have sustainably healthy bodies. So on that very note, my next question is to Ms. Sucheta. Ma'am, yoga is big on talking about lifestyle and habits and practices. So can you please highlight some sort of good routine to be followed that is advised through yoga for somebody specifically, as we are today discussing about hypertension? So somebody who is diagnosed with hypertension or is suffering from it.
Yes. So I would surely recommend to have a morning and night routine, like a ritual, where you have a set of things that you do before you get out of the bed, and also a set of things that you do before you go into sleep. That's because what I have experienced with people who come to us for being able to manage hypertension with yoga is that they're not able to have that full stop at the end of the day before they go to sleep. All of their windows are open, as we have multiple windows open on the laptop, or they have them minimized. There's no window closed. So there has to be a full stop at the end of the day. And having a ritual like, a set of stretches that you do on your bed, that indicates to your brain that it is time for me to get into a relaxation mode. So that routine, same routine for morning and evening, that is one practice that I highly recommend for people having hypertension. Secondly, movements, as Kitty said, movements, just moving the body. Sukshma Vyayam in yoga, basically these are loosening exercises to release the vata from the body. So these exercises, these Sukshma Vyayam, is going to be very, very helpful, because these practices can be done by literally any person, empty stomach. So having these loosening exercises in the morning as a part of the routine. And then if you have a job, a desk job, for which you have to be seated on the chair, then simple exercises or movements that open up your chest very frequently, just taking your arms back and doing namaste behind your back. Even that small gesture is going to be very, very helpful. But if you do it frequently, that will also help. And then two pranayams rather, that are highly recommended. One is Chandra Bhedan Pranayam, where you activate your left nostril, which is Ida Nadi, which is a cooling nadi or cooling channel. So you inhale through your left nostril and exhale through the right nostril. That Chandra Bhedan Pranayam is recommended along with Bhramari, which is the humming bee breath. But I also recommend that these practices should be done under a trained yoga teacher, at least initially when you learn, and then one can practice on his or her own.
Definitely, ma'am. Just like anything, you need expert guidance to start you on the right path to your good health, and later making it sustainable in your life and making it a part of your everyday routine is your individual responsibility. So let us move on to Miss Kitty. Ma'am, it has been highlighted that making sustainable lifestyle approaches are the best way to go to managing not just hypertension, but every disease in reality. And one such thing that Pilates focuses mainly on is posture and alignment of your body. So can you please guide us a little more detail about how can improving posture directly and indirectly benefit with hypertension, other diseases, and also how can we maintain a good posture not just while working out Pilates, but also in everyday routine?
Yeah, so posture and alignment, according to people, is just maybe sitting straight or standing straight and tall. Well, a good posture should actually be your ability to move your body in and out in different positions at all times with ease. And that's why Pilates is actually one of the best. I love yoga as well, and I do it a lot. But Pilates actually engages all your core muscles, which is the powerhouse of the body. Now, again, a lot of people think core is just abs. But core actually, a lot of people would be surprised to hear that it's abdominal muscles, back, and of course your pelvic floor majorly. But it also includes your glutes, your lats, your traps, your hip flexor muscles. So your whole upper body towards your pelvic floor muscles get engaged. So once you are strengthening your core, which Pilates is fabulous at, then your whole body is in a better position and your posture and alignment is already looked into. So like today, most of us are on our phones and we are all developing a rounded back because of our neck moving down and looking down at the phone most of the times. And as a result, it's completely putting pressure on your rib cage and affecting your breathing. And once your breathing starts getting affected, you will start getting more anxiety, more mental issues other than just physical issues, and it'll start affecting your other organs of the body. So it's all interconnected. And that's why shallow breathing will lead to more issues and affect more organs, while Pilates is actually focused on breathing and more exhalation. It's actually meditative and therapeutic. So that's why Pilates helps in just not breathing and not just building core stability and muscle building, but also posture and alignment. It's the best way to do it. And because of its slow and moderate level of controlled movements, the fitness regime actually works in just focusing on your body part. And like I said, everybody is different. You might have the best instructor, but you have to listen to your body while doing a workout. So work according to your body and follow your body, whatever it says. You have to work at your pace. But it does help that Pilates works on a greater range of motion, which helps maintain more mobility. And that's why your posture and alignment is always working in tandem with your breath and your movement.
Thank you, ma'am. Can you also please help us understand that is there a difference between the intensity and frequency of Pilates sessions from a normal person to somebody who's suffering from hypertension? Is there a difference? Would there be any special recommendations or specific precautions or modifications that you would want to highlight in this session? So for anybody who is already hypertensive and is looking forward to go for Pilates, just to keep their safety, in check.
So like I said, Pilates started as a rehabilitation form, and even today, it works beautifully on injury management and pain management. So it's a very apt form of exercise for people with hypertension, purely because it doesn't let your heart rate go so crazy high up. And that's why it doesn't affect your heart health and your breathing and make it worse for your heart to pump blood where the high blood pressure starts coming in. So that's why, because you're working out at a slow and a moderate pace, it works beautifully and the intensity is fabulous here. But you have to be working out at least 3 to 4 days a week to get the benefits of it. Just like Dr. Ishi said, you cannot just do it twice a week or twice a month, or because you have a 50th or a 40th birthday coming up or a destination wedding coming up. It has to be a lifestyle. So while it is supposed to be on a medium level and intensity, the only precaution I would say is please do not follow fads. What is being introduced today on the name of Pilates is something called Pilates HIIT, yoga lattes, which is nothing, which is not Pilates. The Pilates was a traditional form of working out, taking each and every muscle in consideration to just move, align, breathe. And that's why it's called mindful movement, and why the main motto of Pilates is movement heals. So I would just say that don't go crazy. It's not a workout where you have to be jumping around. Even if the whole town is doing it, even if it's a Hollywood or Bollywood is doing it, because that's where trends start coming and fads start coming and we want to look like them. But everything has to be sustainable. You have to follow your own body. But the other precautions are which might work for every other form of exercise. In Pilates, if you're lying down on a mat or a machine or an equipment and you're doing some exercises where your neck is going to be bothered, and if you have a spondylitis issue, don't pick up the neck. If you have a back issue, don't lift your upper body up and do certain ab exercises and stuff like that. So those are just the little guidelines I would say. But also Pilates instructors have to be very good. Like I just said, it's the latest fad in town or a latest workout where everyone's looking fit and all the Hollywood and the Bollywood actresses are looking very good. A lot of people just call themselves Pilates instructors, but you have to be very well trained in Pilates, because in Pilates, you are working with small muscle groups, which are more prone to injuries because they never get used in the gym with the bigger muscle groups like the bicep or the quads or the hams. Those are the bigger muscle groups which might get injured or have a muscle pull, but they heal faster as well. In Pilates, the healing is slow if you get an injury. So your instructors have to be very good. You have to be very careful of what you're doing and with who you're doing. So that's just about it.
Thank you, ma'am. My last question to Dr. Akshay would be, sir, as we are very short on time, can you please help us understand the signs and symptoms for pulmonary hypertension, along with also the signs and symptoms of a less talked about state, which is hypotension, wherein your blood pressure is lower than the normal one, as we are generating awareness on the overall health and well-being. So can you please help us understand both of these, and also the specifications on the management of pulmonary hypertension for our audience to understand in simpler languages?
Yeah. So the biggest myth, speaking about hypertension in general, because I deal with a lot of patients of hypertension and pulmonary artery hypertension. The biggest myth with hypertension is if you have headache, then only you have high blood pressure. That is the biggest myth. Our patients never understand that it is not just the headache. You can have high blood pressure without a headache. But if I speak about the symptoms of pulmonary artery hypertension, initially, if it is developing, you will feel dizziness. That is one of the first symptoms, and you may feel palpitation, that is increased heart rate. It not necessarily be permanent, like throughout the day. It could be intermittent increase in the heartbeat. Then you can feel breathlessness on exertion. When you are climbing up stairs or walking up hills, you can feel breathless. And one of the commonest symptom is also pedal edema, that is some edema swelling in the foot. So these are the common symptoms of pulmonary artery hypertension. And the hypotension, again, that is the fall in the blood pressure less than 160. So if there is decrease in the blood pressure, again, dizziness is again a sign of hypotension as well. But this is about the systemic hypertension, not the pulmonary. So there is no term like pulmonary hypertension. This is the systemic hypertension in which you feel dizzy, you may get vertigo, just feeling of chakkar aana, and you may feel sometimes a tinnitus, that is a ringing sensation in your ear. So these are the common symptoms of hypotension. Now, if we speak about the management of pulmonary artery hypertension, so it is divided into different categories. First is, of course, the pharmacological therapy. Just like hypertension, there are some medicines, specific medicines, which decreases the pressure of pulmonary artery. And other than this, there is so it is a multi-speciality approach. So there are a lot of doctors from different specialty involved in the treatment of pulmonary artery hypertension. So it is not just the pulmonologist, there is an internal medicine specialist, there is a rheumatologist, there is cardiologist, and then we have a team of psychologists and a pulmonary respiratory therapist. So there is a big team which is involved in the management of pulmonary artery hypertension, because it is much dreadful than hypertension. It leads to a lot of mortality, and the ultimate treatment, if not controlled with medication, is the lung transplant. So the treatment is pharmacological, in which there are medicines. Then oxygen is again a medicine for pulmonary artery hypertension patients. They have to be on oxygen if their pressures are not controlled with medicines. And there is pulmonary rehabilitation, which people have to follow. So we advise them to go and meet the respiratory therapist, and they teach some kind of exercises which are good for their lungs, and they increase their exercise capacity. Because people who have pulmonary artery hypertension, they usually are very underconfident. They don't like to run, or they don't like to climb stairs. So the goal is to increase their exercise capacity. And if we control the pulmonary artery hypertension, then we can definitely avoid mortality as well as the risk of lung transplantation, which often people lands up to because they don't understand what PAH is.
Thank you so much, sir. You were able to impart us, information on a very less spoken about topic today. So thank you so much. Coming on to the very last question to all our expert panelists today, as the topic of today's discussion is leveraging partnerships for maximizing the health and well-being of people with hypertension. We have experts of varied schools of thoughts today. We have experts from yoga, from Pilates, dietetics experts, as well as pulmonary hypertension with us to talk about maximizing health and well-being of those who might be suffering from hypertension. So my last question to all our expert panelists is, what would be your guidance to the viewers that are watching for maximizing their health and well-being, focusing on hypertension if they have? If not, general health and well-being. Let us start with Ms. Ishi. Ma'am, please.
Well, it is difficult to condense it in just a few lines, but if I have to, what I would say is everything matters in food. There are no quick fixes. What you're eating, how much you're eating, how you're eating, and when you're eating, all that matters. And all of that matters on how you, in terms of your BMI. So I always say manage your weight and your waist. So those are your two goals. And in terms of food, making sure that you have 2 protein-rich meals a day paired with vegetables, and 1 meal with just fruits or vegetables or a combination. So that is a very important one. And the grains that you have, the cereals that you have, the staples should be as per your gut, what you can tolerate. If you are sensitive to a few grains, maybe commonly today we are seeing wheat, corn, soya, oats. These are the 4 grains which need to be eliminated in some people who have a bad gut. Do that and basically choose the quantum of grain according to you. If you have belly fat, visceral fat, you need to bring it down. If you have belly fat and your BMI is still okay, that means you have a bigger waist, you need to cut down on sugars as well. So basically look at how much of carbohydrates and sugars and cereals, because sugars are not only found in sugars, even cereals are just one step away from sugar. So therefore the grain content, the grain timing, and the grain frequency, whether you're going to have it in 1 meal, 2 meals, 3 meals, is going to be dependent on who you are. So be very careful with that. And hydrate well, avoid too much of caffeine and alcohol. If you do, it has to be in moderation. Avoid processed foods and too much of salt and sugar and trans fats. Those are the processed fats. Have the good fats. And in general, have functional foods. Functional foods are all your fruits and vegetables, spices, and all the wonderful colors in your food. And try and have fiber-rich food, have fermented foods, and also fast sometimes. That also helps to reset the body. And in general, as a general thing, it's a blessing, and I call it BLES: eat better quality, eat less, eat early, and eat slowly, and chew your food well. And combine that with all the wonderful lifestyle practices which have been shared. Do your yoga, do cardio, aerobic, do your meditation, and sleep well. So I think I would leave it at that.
Thank you, ma'am. Ms. Sucheta, what would be your guidance, ma'am, for maximizing the health and well-being of people and also hypertensive people?
I think I would just say slow down in everything, like eat slowly, then move at a moderate pace. So try to slow down in general, during the day, because these days we all have so many things and so many facilities, and we have everything literally in terms of information and resources as well, right? So there is very rarely we are we deal with a question of life and death, which needs you to act very fast. So you can actually just slow down. That's what I would say.
Thank you, ma'am. Ms. Katie, what would be your advice, ma'am?
Move more is the motto. Movement actually heals, and you need to bring in a lifestyle, is what I would say. Whatever works for you. But I personally feel a mix of workouts is a great way to staying fit and healthy, apart from looking at the diet, which is the major part. So your workouts, your lifestyles, everything has to be a sustainable way of living. And that's why do what works for your body, but you have to work out for 6 days a week for sure. ये जो 2 दिन कर ले workout और 3 दिन कर लेते हैं workout, it doesn't work. If you eat for 6 days, 7 days, if you sleep every day, you need to work out and you need to move your body every day. Whatever way it works, whatever is your happy place of workout, do that. Apart from that, I personally feel you need to bring in breathing, whether it's through pranayam, whether it's through meditation, and your sleep has to be the most important factor. Otherwise, everything and all the other aspects start failing if you don't sleep well. So that's been my goal. That's been my go-to. And please do not run after a size or a number on the scale. You have to think fit, nothing about being thin or skinny.
Thank you so much, ma'am. Dr. Akshay, sir, what would be your advice to those that are watching on maximizing health and well-being?
So I would recommend to eat a healthy diet, stay hydrated, lower your stress. If you smoke, stop smoking. That is the biggest killer. And try to prevent illness which you can by taking vaccination. It is for all ages. May it be COVID, we have a COVID vaccine now. Influenza, we have a flu shot which is given annually. If we speak about pneumonia, we have pneumococcal vaccine. So take your pneumococcal vaccine, and it is for everyone, even for healthy adults. So that is my take. Try to prevent illness. And if you have any of the illnesses, please take control of it. Know your disease, take medication on time.
Thank you so much, Dr. Akshay. We wish we would have vaccines for lifestyle diseases as well, specifically obesity. I would get one. But on that note, we thank all our expert panelists for joining us today in this amazing session discussing on how to maximize your health and well-being and supporting yourself to avoid hypertension in the long run. Thank you so much. I thank Dr. Ishi Khosla, Dr. Akshay Budraja, Ms. Kitty Kalra, Ms. Sucheta Karindikar for taking out time from your busy schedule and for joining us, imparting all this wealth and knowledge and information. We would also like to thank our partner, Servier, for partnering up in this hypertension awareness initiative for this month. Thank you so much. And lastly, I would also like to thank our viewers for staying with us till the very end. Thank you so much. On that note, we sign off. Thank you. Stay happy, stay healthy. Bye-bye.
Thank you.
Bye.
Thank you, everyone.
Thank you.
Thank you.